Sa pagpatak ng ulan, sa pagsubok na dumaraan, may tapang kang harap, lilipad kang may pangarap. Lilipad kang may pangarap.
Kailan may di mag-iisa, susulong ka ng may kasama, may tapang kang harap.
Lilipad kang may pangarap. Lilipad kang may pangarap. Simula na ng bukas, ngayon na. Simula na ng bukas, ngayon na. Simula na ng bukas, ngayon na.
Sumabay sa pagbabago,
Harapin ang bagong mundo. Simula na ng bukas, simula na ng bukas ngayon.
Good morning, everyone. My name is Patricia Mirasol, and I am a multimedia reporter for BusinessWorld. With the constant rise of COVID-19 cases in the country, companies who require their workers to report to the office still are challenged to create a strong COVID-19 mitigation and prevention program for their offices in order to protect their people and also to ensure business continuity. Today, we'll be talking more about workplace safety with our three speakers. Our first speaker is Dr. Marco Antonio S. Valeros. He will be sitting in for Dr. Maria Teresita Escocueco, who is in a congressional hearing today. Dr. Valeros is a medical officer at the Bureau of Working Conditions of the Department of Labor and Employment, or DOLE, since 2010. He's a member of the Technical Working Group on the drafting of policies on workplace health programs on hepatitis B, occupational safety and health, tips for kasambahays, chemical safety program, asbestos workplace program, HIV/AIDS, guidelines on working conditions for healthcare workers, guidelines for workers engaged in prolonged standing or prolonged sitting, as well as Department Order 198 series of 2018. He's also a member of the Technical Working Group of the IRR of the OSH law and the DOLE BPI interim guidelines for COVID-19. Welcome, Dr. Valeros.
I am very pleased to be here this morning in your forum. The DOLE welcomes any platform for us to relate to the general public or issuances and programs. Thank you for giving us this opportunity to be here. Working conditions are fundamental to decent work. This is particularly significant today as ensuring safety and health at work is indispensable in the management of the COVID-19 pandemic and the ability to resume work. Work arrangements and conditions change considerably, bringing new challenges for the health and well-being of work. The current pandemic has highlighted the need for safety and health protocols, not just in the workplace, but in all places. The DTI DOLE Joint Memorandum Circular number 4, 2020, entitled Supplemental Guidelines on Workplace Prevention and Control of COVID-19, was issued last year to help guide the employers and the workers as they resume economic activity during this pandemic. The DOLE continuously releases policies that may help improve workplace policies on COVID-19. Very recently, the Department Order 224 2021 guidelines on ventilation for workplaces and public transport to prevent and control the spread of COVID-19, and Labor Advisory number 3 of 2021 guidelines on the administration of COVID-19 vaccine in the workplace. In between these issuances are clarificatory guidelines to help clarify some of our issuances. That's all po, ma'am, and thank you. And good morning.
Thank you for that, Dr. Valeros. Our next speaker is Mr. Philip Marashal. Mr. Marashal is the head of property and asset management of JLL Philippines. He has been a real estate professional for over 28 years, bearing exceptional skills in establishing structure, building employee value, driving vision, and achieving critical strategic goals. He has built businesses and led operations in both startup and established entities in various professional landscapes in France, the United States, and the Philippines. He also has extensive experience in driving performance and efficiency in operations. Mr. Marashal, good morning.
Good morning, Patricia. So, considering what is happening around the world and our region, to create a strong COVID-19 prevention and mitigation plan to protect its people, companies need to go back to basics, and especially they need not to drop their guard. They need to review recovery plans and operation guidelines designated to help prepare sites. A recovery ladder on the next, a recovery ladder should be established. The steps being transition, response, review, sustainability. Let's start with transition. Transition is divided in risk assessment, a review of building common areas, including health and safety gaps, COVID-19 health and safety precautions, potential interruptions to essential services like power and water, and fire safety. Manpower strength readiness. Major components of manpower readiness review should focus on the following: manpower availability, manpower health condition, and also personal protective equipment. Building equipment and facility condition. Property manager service vendors should ensure necessary testings and reviews are carried out. Stock inventory. Companies should initiate a stock inventory exercise for all personal protective equipment, housekeeping supplies, and critical maintenance materials. Sanitation and disinfection activities. Develop disinfection schedule of major touchpoint areas, hard surfaces, doors, handrails. Disinfect all restrooms, disinfect any interior tile floors. Retrain staff on disinfection procedures and chemical mixture handling. The second step is response. So, you heard a lot of hand hygiene, refers to the hand washing, respiratory etiquette, that minimizes the dispersion of respiratory droplets, general cleaning routines. As I said earlier, focus on high traffic touch spaces, protocol for deep cleans, indoor air quality, which is very important. You have to establish an indoor air quality program for buildings, create an indoor air quality complaint monitoring also, and use indoor air quality compliance testing on fresh air units and audits and inspection of fresh air unit distribution. Your proverbial foot sanitizing baths that are set up at all entry points of buildings. Use of face masks and face shields, proven to decrease the release of droplets. Social distancing in elevators and common areas. We have to provide line marks and foot mark directions. And of course, avoid crowding. Create new property procedures. person ingress procedure, shuttle service carrying tenant employees, cafeteria canteen guidelines, tenant coordination meeting process, smoke area guidelines if necessary, payment arrangement guidelines. Occupancy guidelines like spatial distancing strategies, work from home transition, A and B shifts, office reconfigurations, enhanced data collection to track some contamination, and also communication protocol. Property management office needs to communicate to all tenants that the building is safe. We have to release inter-office memos to service providers and their new building protocols and sanitation guidelines. The next step, review. So review is the regular health advisories and other LGU directives alignment. We need to constantly keep ourselves abreast of all new directives. Preventive maintenance. Preventive maintenance activities and some critical projects were heavily affected during the pandemic. And this has caused some serious delays on deliveries and completions. This is attributed to the lack of service personnel and sometimes on the parts also that are missing. Having said this, property managers' officers need to initiate a delayed activity catch-up plan to determine the gaps and potentially prepare how to cope up with a renewed commitment to deliver. Arrange meetings virtual with preventive maintenance service providers to discuss the catch-up plan. Property management officers should start looking into critical parts and equipment redundancy. Property insurances. Review property insurance scope to check provisions on force majeure. If possible, include in force majeure events, pandemic situation where cleanup, disinfection activities, for instance, can be added for possible claims, because trust me, a lot of times it's not there. Identify other potential items may be explored to add in the scope in relation to the learnings of the pandemic. Last but not least, sustainability. Regular premises inspection. Sustaining all efforts in combating COVID-19 would mean regular inspections and walkthrough of both common areas and leased premises. For common areas, this should be done on a daily basis and it should be led by the property manager. For leased areas, inspection should be done with a client representative or the marketing representative. Health and safety committee, it's important, critical to have that. The property management officers cannot do all the work and measures relevant to COVID-19 mitigation alone. They need the cooperation of tenants and other stakeholders to come up with a unified approach for the health and safety of everyone. This is highly recommended to cover COVID-19 precautionary measures. This concludes my opening remarks. Thank you, and back to you, Patricia.
Thank you, Mr. Marisol, for sharing your recovery ladder. That was very informative indeed. Our third speaker is Ms. Rodora Snyder. Ms. Rodora Buenaventura Snyder is a multi-skilled development worker specializing in psychosocial counseling, infant and young health child program, maternal health concerns, occupational safety and health, and corporate social responsibility. She has worked both in public and private sectors, public health and social services, as well as in national and international NGOs. Currently, she is manager of the Corporate Social Responsibility Department of the Employers Confederation of the Philippines. Ms. Snyder, good morning.
Hi, good morning, Pat. Good morning po sa lahat ng panelists and all the, of course, our event organizer. Magandang umaga po. While some parts of the Philippines have started to try returning to normal condition, the COVID-19 pandemic continues to threaten the people's health and more so our employees and workers. Its impact on our labor market, particularly on the quantity and quality of jobs, is a concern that needs urgent attention. Enterprises continue to struggle on how to balance and how to sustain their existence and operations. And since the start of this year, the Department of Labor and Employment, the DOLE, And of course, the other relevant authorities have been working on different issues, some of which have already mentioned by Dr. Mark here, on the gradual reopening of our economy while still ensuring the standards, health protocols are adhered to. The Employers Confederation of the Philippines is working closely with all these COVID-19 stakeholders, including government, non-government, even our counterpart in um, um, the labor, in providing timely updates on COVID-19, not only to our members, but to all business establishments to mitigate the impact of this pandemic. Back to you, Pat.
Thank you for that, Ms. Snyder. Thank you to all the speakers for your opening statements. Expounding further on workplace safety, I'd like to start this discussion by asking this first question. What are the risks of contracting COVID-19 in workplaces? Maybe you'd like to answer this, Dr. Valeros.
Thank you, Pat, for that wonderful question. Okay, the risk of worker exposure to COVID-19 depends on numerous factors, including the extent of community transmission, the severity of resulting illness, existing medical conditions of workers, and environmental conditions that may affect exposure risk, and the medical or other measures available to control the impact of the virus and the relative success of these measures. The risk of exposure to COVID-19 in the offices depends on the likelihood of coming within 1 meters of others, in having frequent physical contact with people who may be infected with COVID-19, and through contact with contaminated surfaces and objects. The government at present highly encourages companies whose nature of operations do not require the physical presence of the workers at company premises to implement alternative work arrangement, specifically work from home arrangement, to limit the mobility of people in the roads and streets and workplaces. This is not possible. There should be a functional COVID-19 workplace program consistent with the government issued policy. That's all, Ms. Patricia. Thank you.
Thank you for that. I agree that it's important to limit mobility nowadays, but how would you protect employees who are compelled to interact with customers? What about in their
Uh,
case?
of course, we have these issued policies as mentioned a while back. We have the JMC number 4 series of 2020, which outlines certain procedures on how to prevent the transmission of COVID-19 in the workplace. So part of that, of course, is uh, the default of using face mask and face shield while interacting. Uh, and upon entry, there should be a thorough screening of workers and clients entering the premise. So there are also other safety and health measures as mentioned a while back by Sir Philip, such
Mm,
as the required physical distancing, the presence of or the availability rather of disinfectants, uh, to limit the number of people in the premises, and of course, an option, companies may also provide shuttle services
mm,
and accommodation, but it is not a mandatory requirement. It's just a recommendatory, and
mm.
we would like to enjoin the companies who can afford to provide those welfare facilities.
Okay. Thank you for that, Dr. Valeros. Now that COVID-19 is a reality, how can companies create their own COVID-19 prevention program? Is it dependent on the industry, the country, or the company is in? Ms. Snyder?
Hi, Pat. To answer that question, as mentioned by Doc Valero, the level of risk, no, of our workers may differ depending on the kind of business processes or business activities that they are performing. But workers at risk, prevention and control programs in the workplace are not established. Every workplace has a different risk and level and exposure, but we should make sure that the companies will tailor fit their COVID-19 program in the context of their organization, no? Yung needs and relevant. And of course, taking into consideration the regulatory requirements set by our authorities, like DOLE and DTI and other authority on this. Every employer and worker has a role in the implementation of COVID-19. But just to sum up, I think what we promote is we call the plan, do, check, and act. So this it's very similar to what Philip discussed a while ago. But when we say plan, that's number one. No, we have to we have to draft our policy. We have to describe it, includes determining the government's requirements. What are those? Latest issuance. From time to time, they issue new policies. So we have our policies in the company should, of course, in consonance with this. And then very important is to do the risk management, because we cannot, we say that we have to tailor fit the programs of COVID in relation or in the kind of the business that we are performing. So this will include methods of proactive identifying COVID-19 hazards in your workplace, who are at risk, who are those who are closely working with other human being, conducting risk analysis and assessment, strategic implementation, of course, on how to mitigate the measures to, of course, in consideration of your resources. And then the assurance, that's the third. It's your program components, no? After the risk assessment, you've seen you recognize that there are some employees who are more at risk. We have to ensure that our activities is aimed to assure that to mitigate the measures, and then making sure also that your business is operating soundly. The last would be the promotion or the act. So we have to ensure that mechanisms are in place to provide relevant information to support the development of a culture, so that our management processes are put in place and, of course, to remain effective.
Thank you for that, Ms. Snyder. So, what if an office has to be shut down because of a COVID-19 case? What's the protocol for that, and how soon is it safe to resume operations? Anyone can take the question.
Okay. Thank you, Patricia.
Okay.
In our protocol,
Of
we encourage granular lockdown. Meaning to say, if the building is, for instance, 7 floors, if the case is just localized on one of its floor, no, let's say third floor, that floor will only or yung a segment of that floor may be locked down for disinfection, but the other part of the building, be it the other floors, should I say, should remain in operation. With regard to how long the lockdown may be, of course, it should depend on the disinfectant that may be used. It depends upon the safety data sheet of the chemicals. Some of the chemicals that we are currently using right now could be used. The building standard could be shut down for 3 hours, 4 hours only, and upon expiration of that time, it is already safe to resume operation. But if the building has clustering of cases in many floors, okay, the whole building may be shut down, and it must be well coordinated with the building administrator, or should I say the joint OSH committee of the building, to ensure that the disinfection procedure shall be implemented as planned.
Okay. Thank you for that, Dr. Valeros. The granular lockdown procedure sounds very practical. Talking about disinfectants, what's the pandemic procedure for cleaning offices nowadays? Is there a certain protocol for doing that, Mr. Marechal?
Yeah, I mean, normally what we do, we clean and disinfect at least once every 2 hours all work areas and frequently handled objects. We try and provide sufficient clean water and soap in all washrooms and toilets. Encourage workers to wash hands frequently and avoid touching face. Provide sanitizers in corridors, conference areas, elevators, stairways. Also, practice physical distancing of a 1 meter radius space between workers at all times. Uh, Communal eating is also discouraged.
Yeah.
We ensure that physical distancing is maintained if eating in dining areas, and we have to dispose waste properly. Clean and disinfect regularly canteens and kitchens, of course. And the decontamination, sorry, my French is kicking in, of workplace should be decontaminated with appropriate disinfectants. I think once this is done, the work area we can resume. We normally do a 24-hour curing time, and workers in the present in the work area with the suspect COVID-19 worker, normally they have to go on a 14-day home quarantine. So that's a bit our process we're doing.
Thank you for sharing that. I wonder if it's ideal for companies who can afford to enact like optimize work schedules and just have staggered work shifts in order to minimize the convergence of people converging in one place at any given time. Anyone?
I mean, I can say that we've done that. I think a lot of companies have done that. Shift A, shift B. The advantage of doing that, it minimizes the risk of a number of people that are in the office, and also if there's a positive case, you still have shift B that's unaffected. If the rest of the first shift has to go into quarantine, so I think it's a good thing to do, and it works.
All right, thank you for that. Thus far, we've talked about the responsibilities of employers. Now, let's talk about the rights and responsibilities of workers. What can workers do in their own personal capacity to take care of themselves, their coworkers, and their livelihood? Snyder?
Yeah, while employers and both workers and employees have their own responsibility, to mitigate the COVID-19 impact at their workplaces. And of course, while the employers should ensure that safe working condition and environment, and taking precaution on by installing protocols and guidelines. But the workers have also their responsibility to cooperate, no? Make sure that when PPEs are distributed, they should take care of this. They should use it properly, and of course they have to adhere, no, to the protocols and procedures of the companies where they are, of course, the companies where they work. So I think that's the basic, and of course, not to be actively participating there, because when we do risk assessment, the employers cannot do it alone. The workers should work hand in hand with their employees in recognizing, in identifying the risk, and of course to follow all the protocol installed.
All
They
right.
also have the responsibility to report. For instance, if they're not feeling well, no, they should report it. They should, as much as possible, they should refrain from going to the office, so para not to expose other workers.
Talking about falling ill, should employees expect their employers to give them healthcare assistance just in case they do get infected with COVID-19? Or is that just discretionary on the part of the employer?
of the Philippines, we give timely updates. We provide executive labor updates whenever there are new guidelines, whenever there are new protocols, there are new policies. We make sure that our members and other business establishment are are aware of this. They have knowledge on this. But yes, in terms of providing services on COVID, more we encourage all companies, no, all employers to provide assistance to their employees, no, by of course maybe they have their own medical health program, or they can also refer, no, making sure that their employees knows what to do. So I think that's the most important thing, no,
All right. Thank you for that.
when to get help, get help. Yes.
Mm.
If I may add, as a general rule, it is not a requirement. It is not mandatory for all employers to provide financial medical assistance to their employees, because of course it should depend on the resources that are available. But as a general rule also, employers, no, may or not may, should, okay, should provide assistance to access to state insurance funds as SSS, Pag-ibig, and PhilHealth. But we highly encourage companies who's financially capable to provide assistance to provide this medical assistance to their employees, uh, if they can afford it, or if this is part of the collective bargaining agreement forged between the management and the union. Okay, that's all.
Thank you for the additional information, Dr. Valeros.
Can I add something?
Okay. Yes, please.
Yes, I mean, I think as a company, we owe it to our employees to work closely with our HMOs to be sure that timely medical support is provided, and whether it's outpatient or inpatient. And we also try and provide free telemedicine support. That's a very helpful thing to do. It's contactless, and it's very reassuring for our, I would say, employees that are staying at home. Beyond this, I mean, also beside the healthcare, we try and provide some care packages for people that are stranded at home, with fruits and vitamins. And we're also looking into, sometimes we're looking into providing some COVID testing kits, home COVID testing kits, so people don't have to leave the safe haven of their homes, and they can check themselves with the help, I would say, of a health professional through Zoom, but they can do it themselves. So that's, I think, is things we try and look into.
Okay. Thank you for sharing that, Mr. Marashal. So I've heard air quality being discussed earlier, and I want to dwell on that topic more, because we all hear the need for adequate ventilations in offices. But what does adequate ventilation look like in tangible terms? Does that mean having a window in every room? Does that mean having two windows in every room? Can anyone please elucidate us?
Well, I mean, I can answer that. I mean, it's the short answer, of course. I mean, ventilation is very important. I mean, manual ventilation, what you're saying is, having one every 30 meters would be the minimum if you had no mechanical ventilation in the office. But what's more important now is that most of the offices have, I would say, HVAC systems, and they are using EPA filters. And those EPA filters, I mean, are like 99.97% efficient at capturing very small particles. But I mean, this is not yet has been proven to for the COVID, I would say, virus. So what a lot of companies are doing, they're adding, putting UV lights for safety measures and to kill viruses.
Okay. Thank you.
If I may add, the DOLE very recently has issued Department Order 224, that is with regard to ventilation. So, of course, we have different types of workplaces, the air conditioned and the unair conditioned. So we have different modes of improving the ventilation system of these two types of offices. It is all there in our issue ones, and we also provide technical assistance in case that establishments may opt to ask on how they could improve on their ventilation system. During our inspection or enforcement activities of our labor inspectors are equipped and capable to provide these technical assistance. Thank you.
Thank you, Dr. Valeros. That's good to hear. So I'd like to switch over to vaccinations because more and more people are getting vaccinated nowadays. How can companies successfully execute their own vaccination programs for their staff? Anyone? Miss Snyder? Oh, I think. Yeah.
Think the employers they have the right to procure the vaccines, and of course to encourage all its employees and workers to get vaccinated, but of course the employer should coordinate with the our authorities, and of course the employers cannot mandate everyone in the workplace to be vaccinated. But I think we have the private sector has the right to procure on its own, and making sure that we are not going to ask we're not going to ask all employees to get vaccinated, and of course the cost should be shouldered by the company.
All right. Okay. Are there any best practice examples out there when it comes to vaccination programs, or not? None yet.
At this point, we are actually doing research on how companies are doing it, especially on the vaccination side. But right now, the study is still being mounted.
All right.
I'm
you,
not
Ms.
sure
Maria.
with. Okay.
All right. So one last question. Let's talk about psychosocial the psychosocial aspect of safety, because safety isn't just about being safe physically, but also emotionally and psychosocially. What is the best way for leaders to communicate in a crisis and help their employees feel safe? Anyone?
I think it's very important, to look out on the psychological and mental health aspect of our workers, especially during this time, that we are not working on under the normal conditions. No, we are working from home. We are in a skeletal force. We are so afraid. Everything is so uncertain at this point, but we are expected to work and to deliver good work. No, so I think I think it's very important to ensure the good quality communication and accurate information. No, we have to communicate this to all our workers. Then update it if necessarily, and then maybe we could make the work a little lighter. We can some companies in fact are doing work rotations. They do work from home. They do shorten hours of work. These are the practices to ensure that our workers are really protected, and making sure that they have this feeling that the companies care for them, so it will lessen the stress, and ensure that everyone has the access, on mental health and psychosocial. The companies can actually think of various programs to encourage workers to participate into, even the simple program, work-life balance, healthy diet. Those are the things that the company can do. Make sure that we provide the right and updated information to our workers in helping them cope up with the pandemic 19.
Thank you, Ms.
Okay,
Snyder. I agree that. Yeah. Okay. Yes, please, Dr. Valeros.
okay. If I may add, the DOLE takes cognizance of the importance of holistic health of workers at this time of pandemic. In fact, mental health is considered as one of the emerging hazards that arise during this pandemic. This is the very reason why we made access to mental health services of workers mandatory in our policy issuances, the 208 series of 2020, and of course, the DTI DOLE JMC number 4 series of 2020. At a minimum, employers are required to develop appropriate policies and programs on mental health in the workplace designed to, number one, as mentioned by Ms. Dang a while back, raise awareness on mental health issues. Number two, correct the stigma and discrimination associated with mental health conditions. Number three, identify and provide support for individuals at risk. And number four, facilitate access of individuals with mental health conditions to treatment and psychosocial support. So access to these interventions may be done through virtual or through telemedicine.
Okay. Thank you for that additional information, Dr. Valeros. At this point, we will be answering a few questions from our audience. Let's check to see the questions that came in. Okay, so we have a question here from Mr. Edwin L. Soliman. Are there any guidelines that the speakers can share for improvement of BCPs of the corporations? Anyone?
BCP stands for Business Continuity Plan, that I guess. So, of course, okay, a workplace which is considered as resilient should have planned ahead of uh, any disaster that may hit the company, no, such as this pandemic. So we have a lot of resources in our uh, that are available. Pero I guess yung government agency that may help you with this is yung Department of Trade and Industry, as they have shepherded a number of companies to get through this pandemic through their business continuity plan forums and technical assistance na provide na rin po sa kanila. So they could engage DTI on this.
Right.
Yeah.
Thank you, Dr. Valeros.
May I add?
Yes.
Yeah, the ECOP, we at ECOP, we do research, no, we conduct studies. In fact, during the pandemic, no, we have already interviewed. We have, we would, I think, 200 plus companies. And these are available. Yung materials is available on our website. This could inspire you. You could, benchmark from it. Companies who have, implemented good practices, good policy, and they survived the pandemic. And how they do that, it's in that study. And of course, yeah, I said 200 companies participated in it. You can access this through our website. I will type our website is www.ecop.org.ph.
All right. Thank you, Ms. Snyder. So go to the DTI or the ECOP website for more information on BCP guidelines. All right. So another question from Kyle Reynald Conrad Baugbog. This is about shuttle services. So it's encouraged but not mandatory. How about the risk of those workers who are riding a bus or jeepney going to the office? How can we avoid being infected because there's no social distancing with those types of transportation? Anyone?
Okay, fighting COVID-19 is it's not just a full of government approach, but full of society approach. So we highly encourage our the general public to report violations uh, of minimum public health standards protocol that you may encounter. The DOTR has released a number of issuance pertaining to safety in public transport. So perhaps you could assist us with proof reporting of this violation. But for our own protection, we should ensure that we are fully equipped with our mask and, of course, face shields, and we should also bring our own disinfectant while riding public transport so that we could protect ourselves. Uh, that's all I could say now. But of course, I agree that there's a lot of violators nowadays, na? Especially sa mga buses.
Yeah. So thank you, Dr. Valeros. Our next question is about ventilation from June Amomonpon. What is the recommendation with regards to ventilation and airflow of the office workspaces? Maybe Mr. Marechal can expound on that.
As I said already, I mean, a lot of offices, and especially the old ones, have not proper ventilation, and the air quality is no good. So we are recommending strongly that the systems, the HVAC system, being renovated and add, I would say, some proper filtration, and also at the same time some UV lights that are a bit more are better, I would say, to fight the COVID virus. So this is the important thing. And also, I would say natural ventilation is very important, if as much as you can. So cross ventilation and that's important, and close them in places.
Thank you, Mr. Marechal. Our next question is from Maan Alvarez. My brother contracted COVID from the office. Is the company accountable? If yes, should companies guarantee medical assistance for when workers get sick at work? Anyone?
Okay, with regard to compensability, if it is acquired to work, from work rather, no, they could avail of the ECC or Employees Compensation Commission uh, assistance, no, medical assistance. This is on top of the SSS benefits that workers may avail. Okay, with regard to the question of if the employer is liable, of course, that needs to be proven. So we welcome any complaint through our regional offices and field offices. Even sa central office, they could submit their complaint, so we could make the proper investigation and, of course, provide technical guidance sa employer. Okay, so pag sa penalties po kasi, ma'am, it's more of yung willful failure to comply. We don't penalize left and right. Okay? So we are providing first, na yung upon investigation, we provide action plan on ways on how the employer and, of course, the whole establishment comply with the requirements of the DTI and the DOLE issuances. But of course, when it comes to compensability, for as long as it is workplace acquired, they could apply for an EC benefit. This is on top of SSS, ha. So maaaring meron kayong double recovery na makuha when it comes to benefit.
Is there a website for that recovery mechanism that you mentioned? Is there a contact number that people can?
Usually, the application is done for the private sector employees. This is done through SSS. They
Okay.
there's a form that is available, easy form. They should have this signed by their doctors, and of course, as mentioned a while back, the office or the safety officer should make a report that the COVID-19 may have acquired doon sa workplace as proof na sa workplace nga siya na ano po no na kuha. Pero once that it is denied by the system, by the SSS, automatic, the request would be forwarded to ECC for an appeal. So they don't need to go to ECC anymore to file their appeal case kasi yung SSS mismo po ang mag-forward po noon sa commission.
Thank you, Dr. Valeros.
They could always check yung website po ng ECC po para sa more information.
All right. Thank you. One question from Ching Kachola. Is it a violation if we house in our employees and refrain them from going home? We are providing free meals to them. Anyone?
Any arrangement of that kind is subject to mutual agreement. Okay? If the worker agrees, of course, wala po tayong pag-uusapan na violation. But if there's some sort of compelling workers to stay, perhaps baka magkaroon po ng problem. So I advise that the employers and the workers should make an agreement para ma-prevent po natin yung possible dispute sa mga ganoong working arrangement. Kasi of course, I understand why the employer means well to help protect yung mga workers po nila to acquire the disease by traveling back and forth. Of course, the workers, we provide them, of course, yung informed decision, yung choice, okay, if they would avail that assistance or not. Kasi, of course, they also need to be with their families. So, maganda na lang po na pag-usapan po yan.
A question from June Amomonpon again. Is it recommended to adopt a national health declaration platform like Stay Safe rather than maintaining existing internal online systems for each company?
Okay, currently, the DTI, DOH, DOTR, and the DOLE will be issuing such an issuance. We would be using a single app for contact tracing. Okay, but it is not mandatory because we take into consideration, of course, yung resources. Meron po yung mga mga establishments kasi may mga micro po tayo na hindi po sila hindi, or yung mga workers mismo wala po silang gadget, okay, para po doon sa app na para ma-avail po yung app na yun. But then as a general general tool, talagang pag-iisahin na po yan para hindi po mahirap ang contact tracing. And of course, we want to restore yung public confidence. Pag nag-open tayo ng economy na itong mga workplaces na ito, medyo na-inspect na meron po safety sila na ibibigay sa kanila. So the safety sila would once na post yan, hindi lang po sila merong presence ng app na binabanggit, but they are also compliant with the yung government issued na protocol. So ayun, hopefully ma-restore natin yung public confidence po sa business once na operationalize na po yung ilalabas ko na ng policy.
Restoring public confidence is very important also for kickstarting the economy. Any other thoughts from any of our other speakers? Okay, so all right, so that ends our Q&A. Before we end, I'd like to invite our speakers to share their parting thoughts on workplace safety. Maybe we can start with Ms. Snyder, followed by Mr. Marechal, and then Dr. Valeros. Ms. Snyder?
Okay, just to summarize what we have been talking about for the past hour. So I think deciding to open or close the establishment, the workplace, or suspend the operation, it should be based on the mutual agreements, based on the risk assessment that the company will conduct, and then of course it's really very important at this point to put in place yung ating mga protective measures and level of compliance din, no? In recommendation din yan based on the authorities, no? Na ini-issue ng DOLE, DTI, and other authorities on COVID-19. But yes, ECOP will still do its part, no? By continuing to engage with our partners, that includes the government, the labor sector, even the international organization, to continue strengthen our occupational safety and health programs. In fact, we have already launched our occupational safety and health academy to assist then small and micro enterprises, and we will provide them training templates on how they can improve their occupational safety and health program in their respective companies. Thank you. Thank you, everyone. It's been a pleasure. So, salamat po sa pag-invite sa ECOP.
Thank you, Ms. Snyder. That Academy for MSME sounds very useful.
Yeah.
We'll be looking forward to that.
Yeah.
Now, Mr. Marechal, the floor is yours.
Thank you very much. I think beyond creating safety practices and COVID-19 protocols in the office that are sure here to stay for the foreseeable future, right now we're not really sure what will be the future of work at the office. So the sentiments of CEOs from world-leading companies is a bit all across the board. From the ones that are office-centric and believe that the majority of their workforce will return to an office setup, thanks to heavy usage of apps to better manage, for instance, desk occupancy and meeting rooms, to the ones that foresee a more flexible setup, as many companies have realized that a lot of things can be done remotely. Although there's still a need to go to the office to have that, sense of belonging. What is a certainty is that employee safety, wellness, and mental well-being is paramount, and this is here to stay. Thanks, Patricia.
Mr. Marechal, I think that safety and mental wellness and taking care of each other is here to stay.
Correct.
And yeah, thank you for that. Mr. Valeros, Dr. Valeros?
Okay, the workplace, because of its resources, has the capacity to be a conduit for the right information for their workers. We hope that the control measures being implemented in your respective workplaces would translate to behavioral change and habit for your workers that they will practice wherever they are, be at home, public transportation, market, supermarkets, or anywhere. The Department of Labor and Employment, in all of its activities, renders its best effort to make employers and workers commit to a safer and healthier and more productive environment. While the government is doing all it can to mitigate the impact of pandemic, it is still through the cooperation and solidarity as united citizens that will make the country heal and recover as one in this difficult time. In behalf of my bosses sa department po namin, I would like to thank the organizers for inviting us here, and magandang tanghali at mabuhay po tayong lahat.
Thank you, Dr. Valeros. So thank you again to Dr. Valeros, Mr. Marechal, and Ms. Snyder for sharing their insights and their expertise. I'm sure our audience learned a lot from it. Thank you also to Globe for making this series possible, and to our partners, Management Association of the Philippines, the British Chamber of Commerce Philippines, the Philippine Star, TELUS International Philippines, and Coca-Cola Beverage Philippines Incorporated. Of course, thank you to our audience for joining us today. Do join us again for part 2 of this workplace safety discussion on Wednesday, April 28th at 11 a.m. Follow Business World to be updated on our next projects. Again, this is Patricia Mirasol of Business World. Good afternoon.
Sa pagpatak ng ulan, sa pagsubok na dumaraan, may tapang kang harap, lilipad kang may pangarap. Lilipad kang may pangarap.
Kailan may di mag-iisa, susulong ka ng may kasama, may tapang kang harap.
Lilipad kang may pangarap. Lilipad kang may pangarap. Simula na ng bukas. Ngayon na, ngayon na. Simula na ng bukas. Ngayon na, ngayon na. Simula na ng bukas. Ngayon na, ngayon na, ngayon na.
Sumpay sa pagbabago,
Harapin ang bagong mundo.